It should be by Dorica or Ammi, I don't know who is speaking, maybe both of you, about the summary of what has been discussed yesterday during the family support groups session.
I think depends on the next slide, I think, because
It's come.
Okay, so I will start. Yesterday, among all the themes that we were discussing with ePAG in our patient council meeting, we have also approached the work plan priorities that ePAG have signaled that they would be interested in developing for the next year. And we had 10 top priorities that we have selected, and then we have voted for 4 top priorities that we will try to achieve next year. So the 10 priorities that first were selected are making available tailored information for patients and improve orientation to the right services for patients, information about patient rights, and preparing short videos, including videos and cartoons to explain better at community level and national level what means ITHACA and what is our work about, because it's very important to spread awareness about the work that is done at European level in the ERN at national level. Then another topic was creating national groups with both ePAGs and healthcare providers from one country to share this information about the ERN at national level. Another topic was to map the existent resources in ITHACA in order to achieve our goals that can support achievement of our goals. To continue the work on patient journeys for other diseases and translate them into the national languages, because until now we have worked on 5 different patient journeys for Prader-Willi, for Williams syndrome, Rett syndrome, Pitt-Hopkins, and spina bifida. And we have mapped together the common needs for patients and in ITHACA. And we would like to continue this patient journeys to develop in the next years. And because we have so many different diagnoses in this ERN, would be probably impossible to have all the 5,000 different rare genetic disease in the next years. But maybe we discuss, we could concentrate probably also on common and cross disease interested topics for patient journeys. Then another priority was facilitate a better communication between centers of expertise and healthcare providers and patients, and stimulate helplines, the cooperation with helplines where they exist at national level, and in order to propose the difficult and unsolved cases for CPNS. Another topic was to contribute to data collection and survey, and we discussed that patients could also contribute to in formulating questions, but also they could be part of ethics committee for registry or in research. Another topic was organizing webinars to share best practices, including sharing best practices between the organizations where the ePAGs are belonging, or to organize webinars on topics of interest for patients like therapeutic education, therapies, transition, quality of life, patients' needs, rehabilitation, habilitation program available. And we discussed, we had 2 sessions, one on quality of life and one on transition, very interesting sessions yesterday. Share best practices between ePAGs, organization, management, project development, ethics, impact assessment framework, and monitoring of the activities was also a priority. We were talking about inviting different experts that ePAGs are interested, but also other networks at European level that could share their expertise and support our work and promote the need for holistic care and integrated care at national level, like a rare resource net, European network of resource centers, and present their services. And the last proposal was on training on different topics, like together with ePAGs and healthcare providers on collective impact and shared leadership, because these two topics probably are will be very interesting in the near future and would support our activity as a team. Next slide, please. So finally, we have voted on the top priorities because we have big dreams, but we also want to stay with our feet on the earth. And these are the four top priorities that were voted by our ePAGs. The first one is to make available tailored information because most of our organizations have information and in different formats for their patients, and improve orientation to the right services like information on case management and how to orient patients to the services that they need in time. And then about patient rights and create or collect short videos, both about different rare disease patient stories or practical videos on case management or other topics of interest. Then the next one is to map the existing resources in ITHACA to support achieving our goals. The third one is to continue our work on patient journeys for other diseases and translate them in different languages. And the last one is organizing webinars to share best practices on topics of interest like therapeutic education, therapies, transition, quality of life, patient needs, rehabilitation, and habilitation programs that are available. So these are the four top priorities that we will concentrate on 2021 in order to continue our work as ePAGs in ITHACA. Thank you. If you have questions, I'm here. Thank you.
I would just add, sorry, I would just take the opportunity, sorry, I try to come up my camera, to take the opportunity to see that probably there are a lot of things that are done in our ICPs regarding therapeutic education, also for webinars made by association, by support groups that are not represented in ITHACA for many reasons. For instance, the fact that they don't speak English currently. And I would ask all the participants to think to what is done in their hospitals in terms of education for the patients and of webinars and everything, and think if they could be shared with ITHACA and with the Patients Council to have a wide, to reach a wider assistance. We have a very active group of family support groups, but we have probably a very small representation of what is existing in all the countries in Europe. So don't hesitate to say we have something interesting in our hospital that could be shared, that could be disseminated through ITHACA, even if you are not, if this group is not represented currently in the Patient Council, and also try to convince your patients group to join the Patient Council. It should be much larger than it's currently. Do you agree, Dorica?
Yes, yes, of course. Yeah, yeah, we would be very interesting to share information and to organize webinars to provide the information to those that need it.
And also to share material that exists already.
Yes, also. Yeah.
Because
yes,
there are a
is,
lot of things that could be disseminated. We have the chance to be able to touch 500,000, 500 million inhabitants through this network. So could be a pity that some very interesting things are just limited to one country or one area.
This is the exercise on mapping the existing resources in ITHACA, because as we said, there are so many diagnoses that it's very difficult to believe that we will create new materials in the next years for all the rare diseases, but we could map what there is already done and can share them. Yeah.
Okay, Ammi, it's your time.
Well, can you give me the next slide? So
one moment. I want to do a question. Yes. During this COVID period, a lot of us has used the telemedicine as an instrument very important to check the health status of the children and other patients. I think that is important at the end of this period to consider the telemedicine as a priority or an important instrument that we must check for the use in diagnosis and in monitoring of the children. So I think that telemedicine can be also a priority to understand the real value.
I agree, because we are developing this kind of tools, and we organize activities on telemedicine. We organize groups of patients for 5 days and meetings with the doctors, counseling online, consultation online, even therapies online, like kinetotherapy, psychological counseling. And I think it's the future. So we are concentrated on this topic too. You are right.
Thank you. So I come back to Ammi's slides.
Yes, please. So I will go through these first slides very quickly, because I think you have seen this before. You see that we have the impact assessment framework pilot. So the most crucial question is, why do we want to measure the impact of patient engagement in ERNs? That is to understand what our role is and identify how we can achieve our goals and explain the value of our involvement. So you can go to the next slide. Yes, so we have had first we had a face-to-face meeting with the steering ePAG Yordis steering committee, and we had a workshop with 20 participants, and we put out the most important things that we think that we should measure. And then we used a model to I don't remember used to capture narrative of change, and the result of the project was the runs equality of access to quality care, improve quality of care, ensure patient-centric ERNs, ensure good level of awareness among the patient community. So the next one, please. So here we have the most interesting one. So so you can see the goals that has been to improve the quality of care and diagnosis and treatments. And the measure is how many times have you been listed as co-authors in consensus statements and clinical practice guidelines. And the question that we are asking is what is the title of the paper? Number of meetings in which ePAGs has participated, number of documents reviewed, how many documents were published with your name. So I should say that this is a hint for you as a clinician on what kind of work you want, where we want to be involved in the work when you are doing your, for example, registries or guidelines and so on. And then we have ensure patient-centric ERNs that meet our community needs. And the first question there is percentage of ERN working groups with ePAG advocates participating as members. And that's an easy one because we are, all of us, all the working groups in ITHACA, we have representation, so that's not a problem for that part. And then we have patient representatives or member in the ERN registry and governance that we have. And then we have more number of patient journeys or service to capture patient needs. And we could say that ITHACA was one of the first ERN ePAG groups that created patient journeys, and we have shown them as best practices in EORDIS. And then percentage of sub-thematic areas where patient needs have been captured. Well, it doesn't, it's a question that's asked. Perception level of satisfaction, that's a subjective questions. And it says, and then there we're going to say how we feel about the clinicians work with you. And then you have potential outcome measures. There are PREMs and PROMs or PROMs. I don't know. I have heard both PREMs and PROMs. And I don't know if we have done any outcome measures within ITHACA, but when the time comes, then we should be consulted, I think, because I mean, this thing that we are, it is a questionnaire on how the perception is for patients. Numbers of posted presentations, that's not so interesting for you in that sense. It's more how we have presented our work to other national and international meetings, like or the organization's General Assembly and so on. And the last two ones is the same. Perception on how the ePAG has organized outreach to its wider patient community, and the perception on how the ePAG has organized outreach to its wider community. So you can go to the next slide, please. So we have done the survey in our group for this. I can say that we are 3 ERNs, the ePAG groups that are has made a pilot of this questionnaire that we have, the measurements. And then we have created a survey for everyone to answer. And here you have the comments and the questions. And I think this is interesting for you to read. And then you have, are you participating in any ERN working groups in your role as an ePAG advocate? 5 of us are saying yes, and 2 says no. And those 2 who says no, they're quite new in our group, so they haven't been assigned to any working group yet. So 3 working groups has invited ePAGs to the meetings. In one of them, an ePAG sends out the invitations to all the meetings. 4 working groups are not inviting ePAGs to the meetings. And the comments from some of the ePAGs or from the patient council says, would have been interested to attend meetings, but I assume they did not feel I could make a contribution. And someone else said, we were not invited to any working group meetings. So that's something we can work on. And then, are there any clinical practice guidelines or clinical decision maker support tools were developed by the ERN and published with your name? And I don't know how many guidelines ITHACA has provided, well, have published, or clinical decision making supports, but we have 1 yes and 6 no. 1 is acknowledged as co-author, and 1 is under development and not yet published. Then we have the next questions are you involved in the ERN ITHACA board? 4 yes, 3 no's. Are you a member of the ERN ITHACA registry group? And then we have 1 from group and 6 or no, and that's how it should be, because I mean we have been assigned to each and every working group, so that's not the thing. And then we have a comment from one of the ePAGs, says most patient parents groups I know of would be grateful if we could have a better idea of prevalence, even if that was the only thing we could have. And then the next question is, are you a member of the ERN ITHACA registry governance structure? And we have 2 yes and 5 no, and that's also clearly, because in the governance, when we made the structure, then the chair and the co-chair of the patient council was invited to be involved in the structure of the registry. And there we have the comment. I have contributed on the workflow application for funding of the ERN registry with the patient perspective. And then you have the last one. Did you conduct patient journeys and service to capture patients' needs? No, I can't see the last one. So, and then we might consider creating as many patient journeys as possible, involving patients and wider community, and maybe to reassess the common needs and update them in our VG working groups. So we have created 5 journeys and 2 hasn't, but that's those 2 who are new in the patient council. And I don't know if I have any more slides. So that was oh yeah, of course, we have the subjective questions. Here we have something interesting. And the first one is, I'm satisfied working as a team with the clinicians of my ERN to advance the ERN goals. And we have 2 rarely or disagree in this case. And 4 agrees and 1 strongly agree. So am I satisfied working as a team with the clinicians of my ERN to advance the ERN goals? And the comments are, I would like to know more about what ways we can help with patient input. And the next one says, improvement on communication with respect to expectations and setting goals forward. The next subjective question is, how often do you disseminate information on your ERN activities to your wider patient community? And 4 says rarely, and 3 says often. And there you have the comments. I used to present the ERN at all our events at national level. Centers of Expertise, National Alliance members, WORKPLAN conference, RDD, and the RD school. And another comment was very difficult to organize a wide communication. Most of the associations do not know nothing about the ERNs. And that's something to think about. And then I've been asked, and how often do you reach out to your wider community to capture feedback? And we have 3 rarely, 2 often, every time is 2. And this says capture feedback and patient needs is a continuous process for our organization. So here you have the result of the survey for 2020. As I said in the beginning, this is a pilot, and soon we are going to look at it and see results, disseminate and see how it works, and if we think we're going to make changes if needed, and people are going to give their inputs on this framework, and we're going to be probably make some adjustments, and then next year we're going to have it fully developed in all the ERNs for the patient groups. So now I think I'm done.
Thank you.
Thank you.
Have you questions from the assembly? We are almost on time. That's perfect.
Why are too slow?
No. We are 6 minutes behind the time schedule, so it's perfect. I think one of the comments I can do is the absence of knowledge of the ERNs in general in the family support groups. I think this is true, and maybe partially because ERNs are a substructure. The patients will never really interact with ERNs, and in the HCPs, ERNs are not very visible. As the doctors do not have a big paper behind their seat saying I'm a ERN member. So I think this probably is seen by most people as something far away from the ground in the European system. So I think we should make more publicity about the fact that we are really working not with the patients, but with the people who work with the patients, and to try to have collaborations between countries, and that we are not esoteric European structure. I just remember you that ITHACA ERNs in general have no legal existence. We are a network. We are not something from a company or an agency from Europe. Really just a network. Other questions?
Alain, may I join you in stressing how important it is to mention the ERN at different levels? It really makes a difference, and I do think people should understand how important it is that within Europe we collaborate in such a way, and it is a task of all of us to spread this as widely as we can.
Yeah, I do, and to remove the idea that we have some of those European agency that makes paperwork. Okay, so
Yeah.
it's time.
Yeah, so I just want to say, so I can say like this. Some of you, okay, well, if I should, I mean, grade you. Some of the clinicians are very good in including us, and some of you might be a little bit better on it. So that's the conclusion to all this survey so far. Thank you.
Thank you. So I propose to have 10 minutes stop, because you have to drink coffee or some other needs. And we come back in 10 minutes from now. So that means in